Today I'm talking all about the use of timeout for children with and without autism and why I rarely recommend using timeout for parents or professionals. If you are using timeout or have used it in the past, you don't want to miss today's episode. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, online course creator, and best-selling author. Each week, I provide you with some of my ideas about turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. As a behavior analyst, I have lots of video blogs that cover a range of problem behaviors and also discipline topics. I have a blog on how to discipline children with autism. I have a blog on what to do when your child gets kicked out or held back in preschool or daycare. I have lots of video blogs on problem behavior and hitting and those sorts of things. But today I wanted to talk about timeout since it is a very common procedure used by both parents and professionals with typically developing kids as well as kids with autism. I think it's almost always a bad idea. I know with my two sons, I never used an official timeout procedure for Lucas, and only less than a handful of times did I ever use timeout for Spencer. Back when they were little, I wasn't a behavior analyst, but now that I am, and I have been a behavior analyst since 2003, I have used timeout very, very rarely because timeout, in my opinion, is very overused. It's a very reactive procedure. It's a punishment procedure, and punishment is not usually allowed within public school settings unless you have a full positive behavior support plan in place and someone highly skilled at the use of things like timeout. And so I think the use of timeout is, people just don't think that it is such a big deal, but it really is. I remember being in a preschool or daycare classroom with a little boy, I'll call him Tommy. He was 3 years old. I was paid to go out to do a one-day evaluation, and they were having trouble with him at preschool, and he was about to be kicked out. He did not have a diagnosis of autism yet, and he had some language, but he was just very, got into a lot of trouble at preschool classes where the teachers had, 15 kids in the class. I think there were 2 teachers, whatever classroom he was in. So I was observing for the day and saw him, touching kids in line when they were in line for recess and those sorts of minor problem behavior. And I'm not even sure what he did. It wasn't anything, really aggressive or anything, but he did something. And one of the teachers said, "Tommy, you're going to timeout." And so I'm just observing and I'm doing my evaluation, and she takes him by the hand and leads him to a desk in the classroom, right in the middle of the classroom. And he proceeds to kick at the desk, and I think he was trying to push at the desk to cause some noise to try to get some more attention, which I think he did intermittently throughout the 5 or 10 minute period. At some point, that teacher or the other teacher said, "Tommy, you're all done, time out, you can get out." And he resumed the class in the classroom. So at the end of the day, or when we had a free moment, free from Tommy, I asked the teacher, how many times a day or a week is Tommy in timeout? It depends. Sometimes 3 times a day, sometimes 3 times a week. What leads to timeout? I was sitting there, I don't even remember why you put him in timeout. She goes, "Well, when we've just had enough of him." Okay, well, as a behavior analyst, using a punishment procedure when you've just had enough is not a good reason to use timeout. When is timeout done? Because I couldn't really tell if it was 5 or 10 minutes or if there was any timer going off. Well, when we just are in the mood to bring him back kind of attitude. So you could see how this treating problem behavior and using timeout, what I call willy-nilly, is going to almost always lead to more problem behaviors and ineffective use of timeout. So I would say with my own kids, I rarely used timeout, only with Spencer a handful of times or less, never with Lucas. Some kids, could benefit from timeout, but really if you are a parent or you're a professional without a ton of experience in this, a behavioral professional, it almost will always backfire. So I would encourage you instead to spend 95% of your time preventing problem behaviors, to use 8 positives to every negative, to consider the appropriateness of Tommy being in that preschool class. He would have probably done fine if he would have gotten more of the positive attention when he was doing the right thing. So maybe he could have a one-to-one therapist or an aide, or just more support, more positive attention when he is doing the right thing. So those are some of my techniques. If you are using timeout, I would say, really take a second look. Make sure if you're a professional, you have standard procedures, what leads to timeout, what leads to getting out of timeout, and also make sure your data is clear and showing a reduction of problem behaviors. If you're using timeout for weeks or months or God forbid years for the same behaviors, then obviously you need to take a really hard look at what you're doing and redesign that intervention. If you enjoyed this video, I would love it if you would leave me a thumbs up, comment, share the video with someone that can benefit. Hopefully it gave you some ideas about the use of timeout and maybe curtailing that. For more information, to get more guidance related to positive strategies to teach language and learning skills and prevent problem behavior, to help each child reach his or her fullest potential, you can go online to a free online workshop at marybarbera.com/workshop. And I hope to see you right here next week.